briefing of the Africa CDC, which we're bringing to you from the headquarters of the African Union in Addis Ababa in Ethiopia. Dr. John, our host, is on standby to give us that briefing, but let me just get some housekeeping issues out of the way. And the usual ones are the WhatsApp number that you can use for your questions when we come to the question and answer session. And that number is +251 9455 02310. +251 9455 02310. But you're more than welcome to come in live with your question or to utilize the question and answer section of this platform. So Dr. John is going to be briefing us on the situation of COVID-19, as well as the vaccination that is ongoing on our continent. Let me not waste too much time and hand you over to Dr. John Nkengasong, who is the director of the Africa CDC. Dr. John, you have the floor.
Thank you, Wayne, and good morning to everyone. And thank you for joining this call today. And as you notice, we've made adjustments to accommodate the briefings that are just came out from briefing the Permanent Representative Committee, and then this very important meeting. We will, I'll do the usual thing, which is give you an update of the epidemiological situation on the continent, as well as what we are doing to support member states, and then conclude with a vaccine and vaccination. So let's start with the epidemiological update. A total of 4.5 million COVID cases have been reported across the continent as of today, and that represents 3.1% of total cases reported globally. The total number of recovery stands at 4 million, that is of the 4.5. And then the total deaths on the continent stands at 121,000 deaths. And that represents about 4% of the deaths globally. Our case fatality ratio is still at 2.7%. And just keep in mind that the global case fatality ratio is 2.1%. The following 5 countries are accounting for about 64% of the total cases reported. And that includes South Africa with 35% or 1.5 million cases, Morocco 11% or 510,000, Tunisia 7% or 305,000, Ethiopia 6% or 255,000, and Egypt 5% or 225,000. So there are 38% of our member states, that is, are now reporting the elevated case fatality ratios. In terms of variants, we have now 20 countries that are now reporting the B117 variant. This is the variant, as you know, that was first recognized and identified in the United Kingdom. 4 additional member states, that is Cote d'Ivoire, Equatorial Guinea, Madagascar, and Togo, are now reporting the B1351 variant. This is the variant that was first identified in South Africa. And this brings a total of 22 countries that are now reporting that variant. And so we see that these variants are increasing. I would just like to make a point here that identifying one variant in a country or two doesn't mean that it has predominated the pandemic. It's just telling you how effective our surveillance systems are in picking that up. Now, the work we need to do now is to monitor those variants and to see if they are becoming the predominant variant in the country. So let's move on to the number of, and if you look at last week compared to this week, the trends that we have noticed. In terms of new cases, the continent recorded 75,896 new cases between last week and this week. And that represents an decrease from the previous week. The highest proportion of new cases came from Northern region or Northern Africa, and that was 38%. The other regions recorded the following changes: East Africa, 29%, Southern Africa, 22%, West Africa, 7%, and Central Africa, 3%. The following 5 countries are reporting the highest number of new cases: Tunisia, Ethiopia, South Africa, Egypt, and Kenya. If you look at the deaths, the total number of deaths recorded between last week and this week stands at 2,184 people dead, and that represents a 2% decrease in when you compare to last week. Let us now look at the 4 weeks trend. That is in the last the period between 29th of March and 25th of April. So in terms of total number of new cases, overall, there have been an average 0.3 average decrease in new cases when you compare over the last 4 weeks. The following are regional trends: 12% increase over the last 4 weeks in Northern Africa, 5% increase in Southern Africa, a 4% decrease in East Africa, 11% decrease in West Africa, and 18% decrease in Central Africa. The following are breakdowns by the most populous countries over the last 4 weeks: DRC, 15% average increase, Egypt, 8% average increase, South Africa, 5% average increase, Ethiopia, 5% average decrease, Nigeria, 12% average decrease, and Kenya, 14% average decrease. In terms of deaths, new deaths, there have been an overall 3% average increase in deaths reported in Africa over the last 4 weeks. The following is a breakdown by the most populous countries: Kenya, 8% increase, Ethiopia, 7% increase, Egypt, 2% average increase, South Africa, 4% average decrease, DRC, 21% average increase, and Nigeria, 69% average decrease. Let's look at the testing. As a continent, we have conducted a cumulative number of 43 million COVID tests since the pandemic started. Over 2.6 million tests of these tests, that is the antigen tests, have been conducted across 12 member states over the last couple of weeks. So just last week, 790,000 new tests were conducted, and that represents an average 26% slightly decrease in 26% decrease from the previous week. Now, in terms of the capacity building, we continue to carry out regional workshops for training vaccinators across member states and for vaccination. And that is a nice segue to go into the vaccine updates. As of 26th of April, 2021, a total of 37.1 million, excuse me, 31.7 million vaccine doses have been acquired by member states, with approximately 17.9 million doses